CD which you are about to see is the result of some work which the HSC has carried out with young people in the Midland region. They met with transition year students to hear their views on the issues which are important in their lives and can sometimes be difficult for them. They have also asked some of these people working within services in the region to tell us about their work and how they can help if we are faced with difficulties which we need help with. Our aim is to encourage people to think a little more about looking after themselves and to give the message that it's okay to ask for help when we get stuck at times in our lives, as we all do.
I don't understand why young people don't seek help. Like, if you had a problem, would you tell someone?
It's not that easy. I'd be embarrassed. Sometimes it's really hard to know who you can trust and who to turn to.
We might think it's obvious to everyone when we are feeling miserable, but they won't know unless we tell them. Pick a time that's quiet and not rush to talk to someone. That way, they're more likely to listen. Try be clear about what you are saying, even though it's difficult to talk about this stuff. Be clear about how you are feeling. I am sad because, I am worried because, I'm feeling miserable because, I'm afraid because. Try to be honest about what's going on for you. Don't be embarrassed if you cry. We all do when we are upset.
It's like the saying, a problem shared is a problem halved. It's important that young people would know that our mental health is affected by our everyday experiences, such as fitting in, bullying issues, problems at home, pressures of exams. What is important is how you deal with these everyday events. The more coping skills a young person has, the better they'll be equipped to deal with these things when they come up.
Positive effects could be your friends could be who you could go to because they're in your same age group. They could have experienced some of the problems that you've experienced and you could go and talk to them, so that would help your mental health because they could be the person that could provide the solution to your problem, or just even talking about your problem would help it. And they'd more than likely understand because they've probably been in the situation and you're close to them and you wouldn't mind sharing your secrets or your problems.
The HSC works to secure and maximise health and social gain for people with mental illnesses, their carers and families. However, there is also a range of voluntary organisations within local communities who work to promote positive attitudes to mental health and provide services to people suffering from mental illness. The following are some of the major organisations, most of whom have local branches, such as Aware, Bodywise, AA, Mental Health Ireland, Schizophrenia Ireland, Samaritans, Grow, Recovery Ireland, and Out and About. As well as these, there are many more organisations that specialise in particular areas of mental health, including the many youth services throughout local areas. So, if feeling low, let somebody know.
The aim of the Mental Health Service is to promote positive mental health, to treat mental health appropriately and promptly, and provide care and support for those who are suffering from mental illness. Your GP is usually the first person you approach with mental health concerns such as depression or anxiety, and your GP may then decide to refer you on to a member of our multidisciplinary team. Treatment options include attending our outpatient clinics, day hospitals, our day centres, access to a social worker, visits from our community psychiatric nurse.
The Midlands Child and Adolescent Psychiatric Services are based at Portlaoise and Mullingar hospitals. Mental health problems are very common in young people. Depression can occur as often as 1 in 4. The causes of mental health problems are wide and varied. Many young people who experience these problems may feel suicidal or may think about harming themselves. The treatments that we provide are mainly talking therapies, otherwise known as psychotherapy. Medications are sometimes needed, but hospital admissions are quite rare. Young people and their families are seen in a private and confidential setting by a team of trained and experienced staff, such as psychiatric nurses, psychologists and psychiatrists. Your GP will know and help you to decide if attending this service is appropriate and helpful.
If you've experienced physical, sexual or emotional abuse when you're growing up, the Adult Counselling Services is available to you for free confidential counselling. We have a free phone number which is 1800 235 234 which you can phone to make an appointment. This service, however, is for adults, so you might have to wait till you've finished school before you can attend this particular service. The local psychology services will be able to see you if you're a teenager for counselling. You will need to be referred by your teacher or your GP to be able to attend the service, and you probably will have to tell your parents that you're attending the service also. This does not mean, however, that the service won't be confidential and that pretty much anything you've said between yourself and the counsellor will remain confidential.
If you are feeling low, you really need to let someone know.